Hello, my name is Dr. Damon Daniels, your Minister of Health, and today we're going to be talking about an important topic. What's under your hood? That's right, what's under your hood? So I'm going to take you back about 30 years or so ago. I was in college and saved up over the summer to get my first car. I was so excited about it. And some of you guys who maybe remember this, if you're in my age group, one of the hot vehicles at that time was a Volkswagen Rabbit. So I saved up all summer, got my vehicle, and you know what I did, right? First thing I got, brand new paint job on the vehicle, brand new paint job. Then the second thing I did, and you gotta have a good speaker system, so I got a brand new speaker system for the vehicle. And then the last thing, you gotta have this when you have your fresh ride. I got some brand new rims on my Volkswagen Rabbit. So I loved it. Drove the car all over the place. One of the things I did not do though, looking back I probably should have done, is I didn't really get tune-ups on the vehicle like I should have. I didn't really change the oil I should have had on the vehicle. So one day, driving to school, all of a sudden, I feel this clink, clink, rumbling sound. I'm going about 40 miles per hour, then it goes down to 30 miles, 20 miles, 10 miles, pull over to the side of the road, car is completely dead. So what I do? I had to get to class, pull my bag out, close the door, walk to class. That was the last time I drove that vehicle. Didn't have the money to get it fixed, so it ended up in a scrap yard, and that was the end of that brand new vehicle that I had gotten myself. The one that I really loved, the Volkswagen Rabbit, with the brand new paint job, with a speaker system, with the brand new rims. By the way, I'm sure all those things, the rims, the speaker system, the paint job probably cost more than the vehicle. So looking back at that, it makes me think about what a lot of guys do when it comes to their health. We have the good job, the house, our toys, but we know nothing about what's under our hood, what's going on with your health. And we can crash out. We can have serious health issues. Well, if you have a vehicle, you just buy another one. But when you start having serious health problems, you can't buy a new body. So I'm going to give you 5 things you need to know, 5 questions you need to know at any time during your life, whether you're in your 20s or 30s, 40s, 50s, if you're older in your 70s, if you know the answer to these 5 questions, it can optimize your health. So question number 1, what is your blood pressure? So a normal blood pressure is 120 over 80 or lower. That's 120 over 80 or lower. If your blood pressure is 140 over 90 or higher, that is considered high blood pressure. And the reason why high blood pressure is so important is that it can increase risk of stroke, heart disease, kidney disease. So it's really important for you to know what your blood pressures are running. Just several weeks ago, I saw a patient for the first time. His blood pressures were 210s over 100s. He was at stroke level blood pressures and didn't even really know it. He couldn't feel it. But the blood pressure issue was working on his body every day. So again, you want to know, what are your blood pressures? The first W. What are your blood pressures running so you can make some changes in your lifestyle and or get on medications, have your doctor talk to you about it. But you need to know the answer to that question. Second W, what is your blood sugar? Diabetes is very prevalent in our country, especially in South Carolina. And it's even more common among African Americans. So you want to know what your blood sugars are at. There's a test called the hemoglobin A1C test. It allows you to look 3 months back in time to see what your average blood sugars are running. So if you have a family history of diabetes, especially if you're over the age of 40, if you have a weight problem, you want to know what that hemoglobin A1C test is. Some patients will have something called prediabetes, which is also identified by that A1C test. And in the state of South Carolina, about 1.3 million people probably have prediabetes and they don't even know it. So again, get that simple test. What is your blood sugar? Find out what your A1C test is. So the third, what is your cholesterol? A normal cholesterol, that's your total cholesterol, for most people needs to be less than 200. The normal bad cholesterol, that's called the LDL cholesterol, for most people needs to be less than 100. A normal HDL cholesterol, that's the good cholesterol, needs to be at least greater than 40. So the higher the HDL, the better it protects you against heart disease. The lower the LDL, the better it is to protect you against heart disease, specifically heart attacks. It's a simple blood test. You can get it at your physical when you go see your doctor, but you want to know what your cholesterol is. So again, what is your blood pressure? 2, what is your blood sugar? Get A1C checked. 3, what is your cholesterol? Get a cholesterol panel to know what your numbers are at. Then, number 4, what is your kidney function? If you go to any dialysis center in the United States of America, walk in there and look around, I promise you 75 to 80% of those individuals are going to be African American, especially in the Southeast. And the main reason that is that we have a prevalence of high blood pressure, which puts you at higher risk for developing chronic kidney disease. You can't feel chronic kidney disease. You can be having chronic kidney disease for years and not know it. But there are 2 simple tests that you can get to help you to identify whether you have chronic kidney disease, and the earlier you identify it, the better you can treat it. So the first blood test is called a glomerular filtration rate. You don't have to know the technicalities of it, but we also call it GFR. It's a simple blood test that looks at how well your kidneys filter the toxins out of your body. So you want to get that blood test and know what it is. The other one is a urine test that looks for protein in your urine. It's called a UACR. Again, it's UACR. So if you combine what your UACR test is and also your blood test, looking at the GFR, that gives your doctor a good snapshot of where your kidneys are functioning. And then they can make adjustments in whether it's your blood pressure control, diabetes control, looking at your diet. There's some supplements that sometimes can help with preventing the progression of chronic kidney disease, but you want to know what your kidney function is. As I mentioned, chronic kidney disease, dialysis is running rampant in the African American community. You need to know what your kidney function is. So again, what is your blood pressure? What is your blood sugar? What's your cholesterol? And what's your kidney function? The last W, and this is really important, guys. This really applies to us. What is your PSA? So you may be asking, Doc, what is the PSA test? It's called the prostate specific antigen test. It's a blood test that allows you to screen for prostate cancer. And the reason it's so important for African Americans is that recent data has shown that African American men, again, check this out, African American men have the highest rates and mortality rate, meaning death, from prostate cancer, not in just the country, not just in the Southeast, but the entire world. We have the highest rates of prostate cancer. And so it's important for us to know what's the status or what screening tests are out there for prostate cancer. That's what the PSA test does. Current guidelines state that if you're high risk, again, if you're an African American male, that puts you in that high risk category. If you're at high risk for prostate cancer, you should start having the simple blood test at age 45. And then talk with your doctor after you get that initial test to see how often you need to get it done. And it really depends on the individual. It depends on your family history. But the bottom line is get the test done. And check it out. That test is a simple blood test. It's not the finger. I know we're afraid of the finger, but we do not want the fear of getting screened for prostate cancer to keep us from being healthier. So I'm going to end right here with a little story. So when I was a resident, Prisma Health Richland Hospital, a local church asked me some prostate cancer screening tests. And I said, sure, I'll be glad to do it. It was a free event. So I show up that morning. They had all the men lined up for me. They were sitting there in a little hallway, and they put me in this little 10 by 10 room with no windows in it to do the prostate cancer screening. So, of course, I had to do the finger exam, and I walked in, tried to keep things light. I said, hey guys, we're gonna do our prostate cancer screening. They all looked at me like, oh man, here we go. So I'm going through, and they just got them lined up, one exam after another. At the end of the day, this guy comes in, and if you can imagine an NFL lineman, 375 pounds, 6'4", comes through the door. He literally fills up the door, and he's sweating, looking at me, all nervous. I'm like, well, sir, are you okay? And he's sort of staring at me, and I said, sir, is everything okay? This is going to be just a simple test. We'll get this done, and you'll be out the door. He says, man, I'm just seeing what I'm going to have to deal with here. So as soon as he said that, I'm like, okay, I gotta lighten this up, keep things light so he's more comfortable. I said, man, as big as you are, I should be concerned. I could lose my hand trying to check you. So again, the point is this. You don't want to be afraid of what your health status is. Get the PSA. You don't have to do the finger test. Just get the blood test. It's much more sensitive. It'll let you know about what's going on in terms of your prostate health. But please, if you're over the age of 45, get that blood test. It is the most common cancer that I see in my practice, and I take care of a lot of African American men. But making that investment can really save your life. So guys, again, we're going to go through the 5 questions you need to know, no matter what age you are as a male. What is your blood pressure? Number 2, what is your blood sugar control? What's that A1C test? Number 3, what is your cholesterol? Number 4, what's your kidney function? And number 5, what is your PSA? If you know the answer to those questions throughout your lifetime and make adjustments, you will live longer. I promise you that. So again, Damon Daniels, your Minister of Health. And as I end, hey, be strong, be wise, and be healthy. Have a blessed day. If you enjoyed the information you just heard, please subscribe to our new YouTube channel called The Blackwell. This channel will be dedicated to African American health with a variety of topics that can help you live healthier and happier. As a matter of fact, I'll be releasing a new video in the next coming weeks on why so many black men are getting prostate cancer and dying from prostate cancer. We're going to talk about how you can protect yourselves. So again, subscribe to the new Blackwell YouTube channel. Have a great day.